Well, thank you very much for the nice talk, Rita.
Thank you.
And let's move on for the next one, which is held by Szilárd. He is a doctoral degree candidate from the University of Southwest University, and will to say prospective cohort analysis for the metabolic-associated fatty liver disease.
Can you hear me? Hopefully. So good morning. Thank you, Balázs, for the kind introduction. Actually, I'm not only going to talk about the cohort analysis of the title, but also about the meta-analysis, which is related to the topic. So I would like to welcome everybody. Actually, it's an honor for me to be able to present in front of such an audience, clinicians, scientists, and basic researchers, and also people who are not afraid actually to change the future and change the future of pancreatology. So it's a huge honor for me. I'm going to talk actually about a different organ, not only about pancreas, because everybody's talking about only pancreas, but of course there are other organs as well, which could be related to acute pancreatitis. And of course, in acute pancreatitis, the most important task actually is the early prediction of the severity. And there is actually an organ which was, I have to say, kind of forgotten from the equation. And this is steatosis, or another name, fatty liver disease, which is actually a spectrum of clinical pathological disease, starting from a simple accumulation of fat in the liver, going to steatohepatitis, and also which can go to cirrhosis, hepatocellular carcinoma, and actually it can cause also mortality. So not only actually this is the most prevalent liver disease currently in also in the Western world, but all around the world. It affects almost 1/4 of the people all around the world. And actually also in children, the prevalence is exponentially increasing, especially in the USA. About the pathomechanism of the steatosis, because of course we are only talking about pancreatitis in this weekend. It's actually, if we want to find the main cause of steatosis, it is insulin resistance. It also has genetic background as all the diseases, of course, but the main cause is insulin resistance, and actually that's how fat accumulation will occur in the liver. If we go further, of course, as I was saying, actually, I have to say that again, steatosis, fatty liver disease, was forgotten from the previous prognostic factors and also from the metabolic syndrome. And I would like to show actually this study of the Hungarian study group, which provides evidence on the multiple hits in acute pancreatitis. So there are actually not one disease only which causes the worst prognosis in acute pancreatitis, but of course, if we look at this figure here, it was of course shown that the accumulation or the presence of multiple diseases can be actually a very good prognostic factor for a worse disease. And actually, this is again what I'm talking about, that for example from here, this equation, the liver is completely missing. And actually, if I'm thinking about what Peter was saying once, that actually if I'm talking about steatosis, of course we are kind of talking about the same diseases, but from a different aspect. And actually at the end you will see actually that there are also basic research results that support the needs of looking at the liver when we are analyzing or predicting the severity of acute pancreatitis. What we have done based on this background, of course, we aimed to research the prognostic role of fatty liver disease, non-alcoholic fatty liver disease in acute pancreatitis. And for this, as we were discussing with Miklós last night, of course, cohort analysis has to be supported also with a systematic review and meta-analysis if it's feasible. The meta-analysis was already published in 2019, and based on that, actually, I will show the results. We found that fatty liver disease and both non-alcoholic fatty liver disease were prognostic factors in acute pancreatitis, and the cohort analysis actually is in progress. We have preliminary, let's not call preliminary results. We have results from more than 2,000 acute pancreatitis cases. You will see the results of that. What we have done for the meta-analysis, we have conducted a systematic search at the end of 2019. And we were looking for papers, of course, investigating patients with acute pancreatitis and comparing patients with and without fatty liver disease. And we were looking for all kinds of outcomes, not only mortality, not only local and systemic complications or severity of the pancreatitis, but also the long-term complications of acute pancreatitis, so the out-of-hospital complications as well. In the end, we included 13 studies in our systematic review and meta-analysis. First of all, I would like to start with the severity of acute pancreatitis and not the mortality. We actually managed to include 9 articles in the fatty liver and no fatty liver comparison. Actually, why are there two subgroups? If you are looking at the definition of fatty liver disease, we all know that, or the non-alcoholic fatty liver disease, we all know that it is a diagnosis based on exclusion. So you need to exclude all the other etiologies, and only then you can say that this was truly a non-alcoholic fatty liver disease group. So that's why actually we put together a subgroup of fatty liver disease patients out of those studies which not clarified whether they excluded or not other type of etiologies for the steatosis like alcohol consumption. And we also managed to do a subgroup analysis only with patients with non-alcoholic fatty liver disease. Of course, in these cases, there were clear definition for the alcohol consumption. And actually based on this, what we have found for the fatty liver disease, no fatty liver disease comparison, if I translate this 3.1 odds ratio, it means that in the fatty liver disease group, there was almost a 50% local complication or also systemic complications. So there was moderately severe or severe pancreatitis compared to the no fatty liver disease group, which was only 24%. And the results were the same actually for the non-fatty liver disease group. And this was also demonstrated when we pooled multivariable analysis for the severity out of the studies. And actually what we have found that there is an over 3 odds ratio for moderately severe and severe pancreatitis. Of course, we have looked also at the in-hospital mortality. Actually, if you look at the studies, you see that almost all of them shows that fatty liver disease also increases in-hospital mortality. Actually, for the non-alcoholic fatty liver disease group, we managed to include only 2 studies, but we see that probably with additional studies, actually also in this case, we would have found increased odds of death in the fatty liver disease group. And here you can see the percentages. Actually, they are pretty the same. And as I was saying, we were looking not only at the general complications like systemic or local complications, but we were also looking at long-term complications. For example, one study by Yuan et al. They found that the abnormal fasting blood glucose level was increased actually after the episode of acute pancreatitis in patients with non-alcoholic fatty liver disease. So I think this is actually a very important study, and this is a reason for research actually for this direction. Of course, there are limitations for all the studies which were included. And also, okay, yesterday we were discussing that probably readmission is not a very good outcome in acute pancreatitis, but anyway, it is a measurable outcome with all its limitations. And actually, a study found that there is over 3 odds of being readmitted with acute pancreatitis if you have also fatty liver disease. And also if we are talking about necrosis, 3 studies reported on the infection of the necrosis. One of them found no significant result. The other one found an increased risk of necrosis infection. And the other study, actually it reported on a very interesting results or aspect, the need for antibiotics in acute pancreatitis. Of course, this was not a randomized study, and therefore conclusion is hard to be drawn, but actually based on their results, they gave more antibiotic for the patients. The definition for giving antibiotics was not clear. So for example, the Tokyo guideline was not referred in this study. If we go further, and actually this is what Balázs introduced, this is the cohort analysis, which is about another kind of liver disease, the same liver disease actually, which we were talking about, the non-alcoholic fatty liver disease. But recently it was renamed as metabolic-associated fatty liver disease, which the difference in this case is that based on this definition, it's a positive diagnosis of metabolic fatty liver disease. So we don't have to exclude all the other etiologies. Actually, in this case, patients can consume alcohol, can have other liver diseases as well. But if based on abdominal imaging, we see steatosis, it can be even an ultrasound or CT, MRI, biopsy, any of the methodologies. If we see that the patient has steatosis and one of these 3 criteria is positive, then we can say that the patient has metabolic-associated fatty liver disease. One of the criteria is being overweight or obese, or having type 2 diabetes, or you may have 2 out of these other criteria, which are the general metabolic syndrome related parameters. This of course, the middle criteria will be fulfilled only on those cases when the patient has normal body weight, or they don't have type 2 diabetes. This is a new diagnosis, and that's why, of course, that's another reason why we wanted to see if this new diagnosis can be used. Actually, I have to say that, of course, for everybody to get used to a new diagnosis is always hard, and this new diagnosis is really attacked in the literature. But anyway, since the paper was published, there are almost over 1,000 citations since then, so it's getting more and more popular. If we go further, what we have done, we use the Hungarian pancreatic study group acute pancreatitis registry, which at that time comprised out of 2,400, more than 2,400 acute pancreatitis cases based on the revised Atlantic classification of the criteria. Out of these, actually, we had to exclude a couple of them. Of course, we were looking at abdominal imaging. We were looking at the status of the liver. So actually, we used the prospective registry, but we had to analyze retrospectively the data and to reassess whether the patient had steatosis. Unfortunately, there were only a couple of cases when there were no abdominal imaging at all. Of course, those has to be excluded. But there were also some cases when in the description, we did not have a clear description about the liver. So we couldn't decide whether it was normal or steatotic or it had any problems. Going further, of course, if I go back then, we were assessing the other role of the criteria, and we were analyzing if there is data regarding the body mass index, there is data regarding the type 2 diabetes, and if there is data regarding the middle group as well. But of course, if any of the criteria was already positive, then we could diagnose metabolic-associated fatty liver disease. And based on this, we included 801 patients in the mortality group and over 1,200 patients in the non-fatty liver disease group. Quickly, I will show just a couple of results about severity and complications. Based on our results, we could not find a difference in the in-hospital mortality. But regarding the severity, it was clear difference between the muffled group compared to the non-fatty liver disease group. The moderately severe and severe cases were in a higher proportion in this group. Of course, if you are looking at what caused this difference in the severity, we see that actually the overall systemic complications were higher in the research group. Also renal failure, respiratory failure, but not heart failure was different between the two groups. If I go further to the local complications, the peripancreatic fluid collection was again in a higher proportion, same for the necrotizing pancreatitis, but not the pseudocyst. We did not analyze the mode of necrosis. If we go further to other outcomes, then the diabetes as complication, which I would highlight, was much higher in the metabolic-associated liver disease group. And actually, in hospital stay, of course, is a very subjective or not so strong outcome, but that was higher as well in the mortality group. We also did, so this was the univariate simple analysis. We also did a multivariate analysis, and actually we will continue this analysis. We analyzed, first of all, whether if we put together all the fatty liver disease group, whether it increases the odds of moderately severe and severe cases, and we found a significant difference. We also analyzed the different type of fatty liver disease patients, and interestingly, there was no difference in these groups. Also, based on, if you go back to the criteria, multiple criteria can be positive for a patient. And what we have done, we try to look at the dose response, some kind of a dose response relation. And we found that actually if one criteria was positive or three criteria, then there was a significant result. And same, of course, as I was saying at the beginning, we don't have to exclude alcohol consumption, and neither we have to exclude other liver diseases. But if we exclude alcohol consumers, then the result is actually pretty the same. If I'm summarizing both studies, of course, I would start with the strengths. I think in the meta-analysis, we managed to include a high number of acute pancreatitis cases. We also managed to prove that it is the fatty liver disease is an independent predictor for a worse outcome in acute pancreatitis. And we, of course, used a very rigorous methodology. In the cohort analysis, also we included a high number of patients, and luckily, most of the patients had multiple abdominal imaging, so not only one and not only ultrasound, but CT as well. And because of that, the steatosis was quite clearly diagnosed in these patients. But of course, we are aware of our limitations as well. We found moderate risk of bias for the meta-analysis. We also included abstracts and papers in Chinese language. All the papers were retrospective single center publications. The problem with that most of the papers were published from Asian population is that it is hard to generalize the conclusion. And if we look at the definitions of acute pancreatitis and fatty liver disease, of course, there were differences.
I'm sorry to interrupt.
Yeah, sure. The conclusion is coming, actually. The conclusion, of course, is that it is a very good prognostic factor if we are looking at the disease. And what we can do, actually, we should use it in a prognostic tools. We should consider a different approach in this group, and it's very easy to diagnose disease. And anyway, Miklós will have questions regarding why we should actually use this this disease. Then I think I will keep this slide for Miklós. And actually, I would like to thank you for your attention, and sorry for going beyond the time. Thank you very much for your attention.
Not have time for questions. So
Miklósan.
After the session.
Gambling time.
So
Thank you very much
for the next one.